So what we know is that this is a novel coronavirus, a new coronavirus that has not previously been detected in people before. It was first identified in a group of individuals with pneumonia in a city called Wuhan in China. What we know is that people who are infected with this virus develop respiratory disease, which means some people will have mild symptoms, which could range from a fever or a runny nose or a slight cough, but some people can also develop pneumonia, and in some patients and some people, they can have very severe disease and die. Occurs through a respiratory route, which means droplets. So these are small particles that either transmitted through like a sneeze or a cough. But transmission between people occurs amongst very close contact, so family members or healthcare workers. So you have to be in close proximity to one another. We also know that this is a coronavirus, and the original source of this outbreak is likely an animal source. That's currently under investigation. We haven't identified the animal source, but in the beginning of this outbreak, what we believe has happened is that the virus moved from an animal to people. So we've seen some reports that it's possible that people who don't have any symptoms can transmit to other individuals. This is what we call an asymptomatic person could potentially transmit. We've only seen some case reports of this, so very few numbers. If you're not feeling well, you stay home. And you practice good hand hygiene, where you're washing your hands with soap and water or an alcohol rub, making sure that when you practice respiratory hygiene, you're sneezing into your elbow, you're using a tissue and you're throwing that away right away. So if you do have fever and you have a cough, you should
difficulty breathing.
Thank you, and difficulty breathing. It is important that you do seek health care. So because this is a new disease, it's a new virus, we don't have specific treatments for that virus. But because this virus causes respiratory disease, those symptoms are treated. We've heard a lot about antibiotics, and this is a virus, so antibiotics won't work against the virus. No. So, but I should say that there are treatments that are in development, and this is really important because for the past many years, many treatments are being looked at to treat other coronaviruses like MERS coronavirus, and hopefully those treatments can be useful for the novel coronavirus.